Good afternoon. I very much appreciate receiving this year's Outstanding Researcher Award. I'm a senior fellow at NRHA, serving its Walsh Center for Rural Health Analysis. I've been a researcher for most of my career, focusing on rural health care delivery because of the many challenges and lessons it poses to researchers. My story reflects valuable experiences from both private and public sector organizations. I've learned that rural problems, such as barriers to access, can sometimes be fixed with policies derived from a good understanding of rural, plus research findings that speak to rural issues.
I guess Curt's story began in high school, where seniors were required to study economics. But for many of us here today, our knowledge of his story begins when, in the mid-90s, Curt served as the director of the Walsh Center, based first at the Project Hope Center for Health Affairs and later at Newark, under Dan Galen's leadership of the health program. Center staff collaborated with other rural research centers in planning for the Medicare Flex program, an effort that has helped shape the critical access hospital concept. Curt is justly proud of the center's concept of rapid response research, a concept that later influenced grants from HRSA's Federal Office of Rural Health Policy. Curt left Newark about 15 years ago to become a Medicare Research Director at the CMS Innovation Center. There he directed evaluations of demonstrations, including the Rural Community Hospital demonstration, and provided technical support in designing Medicare's merit-based incentive payment program. The challenges of rural markets were subjects of his work as Director of Research and Evaluation at our Federal Office of Rural Health Policy, where his accomplishments included helping CMS staff convene rural experts to address the challenges of measuring quality of care in rural areas, conducting and disseminating research and policy information at various forums, including NRHA's annual conference and Policy Institute, and helping me work with the CMS team during the design of the Frontier Community Health Integration Project demonstration. More than once, Curt saved me from myself, always providing an informed, more effective, more nuanced approach to the issue at hand. After retiring from the federal government, Curt returned to Newark, where he is continuing to conduct research, both with Newark and the new East Tennessee State University Newark Rural Health Equity Research Center.
Again, I'd like to express my appreciation to NRHA for this honor. Many people have had significant impacts on my work, but the most special include Julie Schoenman and Mark Burke from the original Walsh Center, Paul Moore and Tom Morris from the Rural Health Office, John Gale with the Maine Rural Health Research Center, and from NORC, Dan Galen, Alana Knutson, and Michael Mead. Thanks to all.